weeks. You know, just be very careful.
Excuse me. What was the reason for the blood clots or the lack of blood flow?
Well, that's such a logical question that I almost feel stupid not to be able to give an immediate answer. But the truth is, we don't know. What we do have is the proverbial differential diagnosis. So, one possibility is that in his right hand, he does not have a blood supply which one or the other artery can make it work. It's called a separated arch. There's an arch of blood that goes in between. If that is separated, if you're born with that separated, then it's possible that if one artery is supplying it, the other side won't get it. And there's not much we can do about that, but if you have trouble with the artery on one side, then these fingers might not do well. The artery that was on this side was under the most burned skin that we tried to cover, and that may not have been giving good enough coverage. So that might be one explanation. Another explanation is that the donor comes to us having gone through quite a bit. The donor, unfortunately, has actually died, and so you're keeping the circulation going using drugs that decrease the amount of blood flow to the hand. And we had lots of problems on both sides with this, because on the left side they had actually stuck the patient, who was now deceased but who was the donor, to give drugs to keep the heart beating so that they could, you know, harvest all the different organs. And then all those veins were clotted. I think I mentioned that before on one side. And on this side, the thumb and index just never worked. So those are two possibilities. The thing that we do know is that we did a test after the surgery on Wednesday where they put a tube in and you run dye into the hand. It's called an angiogram. We were able to visualize the whole blood flow to the hand. These fingers are getting blood flow. It's coming from this side, the ulnar artery, and it looks sufficient to keep it alive. But why the blood flow doesn't fill completely this side, it's either that it got shut down, as I said, from the drugs that were used, or you may not have big, complete vessels connecting it. Then I can make up more theories. You know, it seems that it would be so simple to know, but once things get clotted, you don't know. When you open up the arm to fix it after this, everything's clotted. Because once one starts, it's like dominoes falling, and the whole thing clots, and you don't really know what was the first and what may have caused it. I gave you a complete long medical explanation there.
Is he still in the hospital? And also, when you talk about future surgeries, when do you think he might need future surgeries, and what might those surgeries be?
Oh, well, right now I hope there's no future surgeries for, you know, a year or something. I mean, the course that we hope we'll be following is that for the next week or so he'll remain quiet to 2 weeks or 10 days. Then we'll start physical therapy, and then physical therapy will progress, and he'll go through all the steps that everyone else has gone through. And then at a year or 2 years or something, if we find, and this can happen sometimes, that if he's in a cold environment, that the thumb and the index bother him, or if we find that there's been a lot of scarring and we feel he could get a better fist, we'll discuss with him doing an elective procedure to either loosen scar or try to reconstruct the artery. But I think we've had enough operations with long enough time if we can avoid it. Of course, our concern is that he does something like what happened before. He looks fine, he's moving his hand, he's doing his therapy, and then we lose the circulation. And we can't predict these things well, except to say statistically, when you get out 2 weeks from reattaching a part, a finger or part of a hand or a whole hand, rarely do you have problems like this. Not zero, but rarely. Right now, he's in the intensive care unit, and he's really there more just to make sure we have minute-by-minute monitoring. I mean, he's sitting up, and remember how in the last press conference he scratches himself with the other hand? He's doing all that. I mean, but this hand we're holding quiet. We're not letting him move it a lot. And the trouble is, if he goes to a floor, which I think we probably will discharge him to the floor tomorrow, but he doesn't get his close monitoring. So it's for really the close monitoring that we had him in the intensive care unit for the last 4 days or so.
Dr. Breidenbach, just to clarify, so he'll be quiet for the next 10 days or so with the right hand, but he's proceeding with therapy.
That's correct. Yeah. So we have a diversion. Everything's continuing along as though nothing happened on the left. We got to kind of go back to square one on the right.
And isn't there some talk about possibly needing a skin graft to do better coverage on the hand?
Yeah. One of the concerns is that the reason we may be having this problem is because of the burnt skin which he has, which is much more extensive on the forearm of the right than the left. And now that's a theory more than something we know. But if we felt that that was a problem, then we would have to go back and either take tissue from another part of the body to cover it, like what we call a flap, and that's vascularized, or try to put new skin grafts on it. I was actually a person who kind of was a proponent of that, a proponent of that theory, but I'm not sure that that's correct, but I don't know. And at this particular point, the artery that is running the whole hand is in a little bit better tissue coverage, so it's probably not going to be necessary, I hope. He does have some small areas that in all this excitement, the skin grafts we had put on got scraped off. I mean, very small, like this. We may have to put a skin graft on that, but we could almost do that on the floor. The right hand, if you look at his preoperative forearm, if you look at his right preoperative pictures, had more scarring and more burns, and it had more operations. And as a matter of fact, they had taken skin from this area with the blood supply attached to it prior to the transplant and rotated it down to the hand to cover it. And that's why we didn't have any radial artery, the artery on this side in the patient. I feel like I haven't given you nice, crisp sound bites, unfortunately, but it's hard to explain. I guess the simplest thing to say is that for reasons that we don't know, he got clots. We have lots of theories how that could have taken place. And we had to go in and redo the plumbing, which is basically take out the bad pipes, the arteries, put in new ones, and get blood flow reestablished.